I am Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. Julie, Dr. Fauci, I hate to hit you right off the bat with something he said, but now that many of us have been vaccinated, he's saying it's time to maybe reevaluate our use of face masks indoors. What say you about that?
Well, you know, he's obviously the expert on that, but some people are going to continue wearing them. They're just more comfortable with it, and that's totally fine. I mean, I think that people will do that, and we who are vaccinated can do things, safer. And I will go in now and eat in a restaurant and have been doing that, and I'm comfortable with that. But what we're seeing now are people who are not vaccinated who think that because others are getting vaccinated that they're somehow magically protected, and they are not. And we continue to see, cases. We continue to see hospitalizations. We're up to 18 hospitalizations right now, and we continue to see deaths. We're up to 147. So people who are vaccinated can act like they're vaccinated and start safely doing more and more things, but people who are not, they cannot. I mean, they may do it, but they're not safe doing it.
Since you brought up numbers, we'll get into that. 18 sounds high. We've been on a good downward trend, but tell me where we are with the numbers in this area.
Well, right now we are at 323 active cases, 346 in quarantine. That's a 3.5% positivity rate. And like I said, 18 currently hospitalized. So, I've mentioned this before. If you're not vaccinated, you are not protected. So we're going to keep seeing cases in that. We are up to, I'm very happy about this, 83.43% of seniors 65 and older are vaccinated. But again, that still leaves a lot of people out there who are not protected and who need to get in there and get vaccinated. We are up to 77,557 people in our county who are fully vaccinated. So, we're getting there, but right now there is zero waiting for vaccine. We have all three types of the vaccine in our community. You can get it on a walk-in basis. You can go to Walgreens. You can go to Walmart. You can go to, Carl for the walk-in. You can go to us for the walk-in. There are all kinds of places to get it. OSF. Just the best thing to do would be to look at vaccines.gov and find a vaccine and get in there and get it as soon as you can. Anyone right now 16 and up can get the Pfizer, and probably by Thursday, that's what we're anticipating. By Thursday, anyone 12 and up will be able to get vaccinated with Pfizer as well. So, plan your vaccine.
12 and up, and that's what I've been asking about this whole time. It is inconceivable to me not to give my child the science and trust the medical professionals and get him this vaccine. That's all I've wanted this whole time. 52% of parents say they're likely to get their children the vaccine. That leaves 48% who say they won't. What is the hesitancy, or how can we convince them this is the way out of it?
I'm not 100% sure because, I know that there are people who vaccinate. We kind of vaccinate in waves. There are the people who are banging down the doors initially to get it. And then there are some who are waiting just to see, how it goes and how it goes for people. And then they'll go. And then there are some who will never get it no matter what. That's a very small percentage though. So I look for there to be definitely more than 52% of parents getting their kids vaccinated, because this is going to be the way back to a lot of things, doing a lot of things safely. So I think, 12 and up, we're already seeing a good response, I understand, in the schools.
I look over at India and I wonder, that might have been us, but now with a little bit of perspective, our numbers are coming down. Could that be us if we don't continue to vaccinate at a higher rate?
Well, hopefully, that won't, hopefully, because we are getting people vaccinated. So, the vaccinated people, for the most part, are protected. It's not 100% vaccine, but it's very, very high efficacy. And, there's been over 1 billion people vaccinated already. So I don't understand what people are waiting for. In the United States, we have I don't know the whole United States, but certainly in Illinois, and absolutely 100% sure here in Champaign, we have access to it. It's free. People can get it, pick which of the 3 vaccines they want, and so there's really no excuse to wait. Once you're hospitalized, it's a little too late to be thinking about it. But with that said, this is another thing that I think people are holding back on. If you have had COVID, it is still recommended that you vaccinate. So just because you've had COVID doesn't mean that you don't need to vaccinate. So we just need to make sure that everyone that's eligible right now can get in there and get vaccinated.
The studies that come out keep showing that the variants are also protected with the vaccine in it there. Is that encouraging to you? Is this a surprise? Tell us your feelings on that.
It is encouraging. It's not really a surprise because, what we're trying to do definitely is get people vaccinated before, and it's got to be people vaccinated everywhere before there is a mutation that ends up, blowing past the protection of the vaccine. So, and if that happens, like I said, the architecture for the vaccine is already there. So we just have to they'll just tweak the formula to the new variant, and then people will have to have boosters. But right now, that's not the case. So, the faster people get vaccinated, the better, and the sooner we can get back to some normal activities.
I know that public health and what you're doing is keeping everyone safe. You're focused on vaccines, but can you sort of dumb it down for some of us who don't understand the emergency use versus permanent use? If people are hesitant to get the vaccine because they say, well, the FDA didn't even approve it for, what's the difference? Can you kind of break that down for us?
Yeah, time is the difference. So they're doing all the studies on it. The vaccine went through the same process that they always go through. The difference was on the front end with getting a lot of things pushed through early into the testing phases. So that was kind of the initial thing that made it different. But right now, every single study that's come out has shown that these vaccines are safe and effective. It's just study after study that they keep doing with them. But really, the point of the emergency use authorization, and that process came around as a result of HIV/AIDS, is that you can't wait for everything to go through the full, years-long process. I do know that the Pfizer vaccine, that they are ready to, I don't think that they've done it yet, but they're getting ready to this month, I believe, put that through for the full FDA approval. But it just has to do with time and the amount of studies. You can't just hold off and say, we know that this vaccine is safe and effective, but we're going to hold it until we're done with all of our FDA studies, especially with all of the deaths that were happening. That would have been, unethical. So emergency use authorization is not something to be scared of. And while people are being vaccinated under that, they continue to be being studied, and they are looking at every little thing. That's why they were able to catch so early the potential for an issue with the Johnson & Johnson, which turned out not to be a problem. But that's how close they're looking at everything during this time period. So if any little thing shows up different in the stats, then they will know about that. So it is, I know people call it experimental. That is absolutely not true. That would have been if they just, somebody just developed a vaccine in their lab somewhere and then just cranked it out and started putting it in people. That would have been a whole different thing. And that's not how it happens.
Are we possibly headed in the right direction if we stay as we are, but if we get lazy or lax, that we could head to a fifth, a sixth, a seventh spike? Because there are warnings that winter flu season could get us back where we were.
Yeah, right now, I think, this is like we're in a good place right now. We are going into summer. We will be able to, things will start opening up. People can do a lot of things outside. People have all the opportunities to get vaccinated. So hopefully people who have been waiting to see, how their friends did, how their family members did, hopefully they will start getting vaccinated. Kids will start getting vaccinated. And, the more people vaccinated, obviously, then the safer it will be. But I cannot stress enough that if you're not vaccinated, you are not protected at all. And these variants are very, very infectious. And like I've said before, we're seeing people who are younger with this getting a lot sicker. So we need to make sure that people take this seriously, because if we got, I would love to see us have 85% of our county vaccinated by the time we move into fall. That would be amazing. And that would mean that that would make me feel a lot better going into winter. But yes, just because we didn't have flu last year, the flu numbers, we're not going to be in that position this year, because we're not all going to be staying home. Kids will be back in school. When you have kids out of school, that's going to prevent a ton of transmission to parents and things. That's just how it works. But, we will be in a position this fall for flu to come roaring back. So we'll deal with that when we get closer to it. But we have a great opportunity right now to get people vaccinated, get at least 85% of our county vaccinated by the time we move into fall.
Before I let you go, let's say I'm one of those people in the group you just mentioned that wanted to see how my family and friends did with the vaccine and the side effects. Okay, fine. Now I'm convinced I really want life to open up for me. I'll get vaccinated. Where do I go? Where can I walk in and get my vaccine?
You can walk in at the Dress Barn location that Carl is operating up near Kohl's. You can walk into Public Health on Fridays. We just have walk-in clinics. We have on our website, information about where to go. Walgreens, Walmart. I don't know if they're walk-in right now, but there's plenty of vaccine in our community. So the best thing to do would be to go to vaccines.gov and type in your zip code and just find out, where it is. You can read about them, what kind of vaccine you have, and now we're to the point where if you want to pick what kind of vaccine you get, you can. Because we have all three in our community, and we have a lot of availability. Nobody's letting their foot off the gas, if you will. We're continuing to do lots of outreach clinics. Carl's continuing to do lots of outreach clinics. We'll start, basically anyone who's interested in having a clinic and have people there ready to vaccinate, we will get people out there to them.
While we're talking about things that we're lucky to have in this community, this is an awkward transition, but award-winning producer Jason Liggett with UPTV in the city of Urbana. I got to spend some quality time with Urbana's amazing mayor this weekend. Of course, Diane Marlin, thank you. And Julie Pryde, we are the luckiest times 10 to have you and CUPHD here watching over us. Thank you for everything you do.